Or do you want to come here? Do you want to come here? Yeah, yeah. Listen, do you want? Yeah, do you want to come here? We can cut the ribbon. Come on. You come with me? Yeah. Okay, come here. Come here. Okay. Right. Okay. Good morning. I think it's still morning, or good afternoon, everyone. I'm Councillor Chowdhury. I represent the Beach Hill ward, and I'm also the portfolio lead for public health. I'd like to sort of thank everyone who's come today to support this important initiative, which is a partnership initiative between Luton Borough Council, the NHS, community partners. There's a load of partners. I'm sorry if I'm not able to go through all the sort of names of all the partners. It is such an important initiative because I mean, the uptake of immunization has been sort of dropping year on year, and this is such an initiative, sort of welcome initiative for this ward, and especially the Berry Park Community Centre. It will make the immunization more accessible and available to the community. I won't say anything more, and with this, I declare, or I, do you want to, come on darling, shall we do it together? Yes, this is for our young people, it's their future, and I'd like to declare this open. Thank you. Thank you. Yeah, thank you so much. Was that okay?
Perfect.
Okay, was that okay?
Yeah, perfect. Thank you so much.
Thank you.
This is the link for the Hertfordshire program. If you just want to follow
We're going to be Bury Park. This is Bury Park Community Centre. If you come in, you see arrows going all the way across for the Health Hub. So Bury Park Health Hub is officially launched. The ribbon has been cut. There's going to be a couple more speeches inside, and they will tell us a little bit more about what the Health Club is and what it does. So Bury Park Health Club is here, so we are inside. We are inside the inside Bury Park Community Centre now, and we've got lots of amazing stuff here. They'll be here till 1 o'clock. So if you want to come down, check them out. They are here till 1 o'clock. So just be waiting for a few speeches now and see who would like to speak. So vaccinations in pregnancy, getting vaccinated while pregnant helps protect you and your baby. The RSV, whooping cough, flu. There's walk-in or book an appointment. You can do that. Lots of information available here. Thank you. Yeah,
Right. You know, I think it's all
Introduce themselves if they speak.
Just need to mic up whoever's speaking.
Okay, first of all, can I get my speech and can I my bag? I need to get my. Oh, yeah, thank you.
You want towel? Towel?
No, maybe later.
Maybe later.
Where did you give me a towel from?
Meter towel, I got it from outside. From KO, was that what's the name?
99. Oh, that's good. And can the speakers please introduce themselves? Yeah. Good afternoon. I'd like to welcome everyone today. I'm Councillor Rumi Chowdhury, portfolio holder for public health. This event is the start of an important initial 2-year collaboration between the NHS and Berry Park Community Centre to work together to improve access and uptake of child immunisations. In the last 10 years, there has been an overall decline in the uptake of child vaccinations across many communities, not geographical locations, but a real difference among Black and South Asian communities. To reduce the risk of large outbreaks of vaccine preventable infections, we aim for 95% vaccine uptake for all child vaccinations. At this level, the risk of an outbreak is low. In the last 3 years, the year-on-year decline in child vaccinations uptake has been a concern and has led to large outbreaks of child infections, especially measles and whooping cough. These and other child illnesses caused by these infections are preventable by getting children vaccinated when they're invited. The low uptake has led to children becoming seriously unwell and hospitalized. In Luton, our uptake of child vaccinations is lower than England's average for all vaccinations, and the uptake is even lower in this area of Luton than the Luton average. By the time a child starts school, approximately 6 children in a class of 30 will not be fully protected, and in some primary schools there are more. This is not a quick fix. This is why today is so important. I'd like to I'm here to share the message of all health colleagues that vaccinations are highly effective and safe. healthcare intervention administered by trained health professionals. It is important that when our child is vaccinated for vaccination from 2 months of age until they receive their final preschool boosters between the ages of 3.5 years and 5, that you do take up the offer. Vaccinations are important health intervention that keeps a child healthy and reduces their risk from preventable infections. By getting your child vaccinated before they start school and start mingling with other children, you are not only protecting your child, but also reducing the spread of infection to the very few children who cannot be vaccinated due to rare health risks. I know you've heard these messages time and time again, and about why it is important to get your child vaccinated. Events like today's create space to have conversations with healthcare professionals about any concerns you have about your child being vaccinated. And while it will be great to get children vaccinated today is more importantly about the conversation, sharing information, getting answers that will help you decide and when you are confident and ready to get your child vaccinated. Thank you very much. Sorry?
The mic, please. Would really like to.
How to take it off.
Thank you very much.
Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh, and good morning, everyone. My name is Abdul Ghafoor, and I'm speaking on behalf of the Luton Muslim Health Alliance. And I suppose that's the first thing I'd very briefly like to talk about. Why is the Muslim Health Alliance here? What's the nature of the partnership between the NHS and the Muslim community here? And I'd just like to share a couple of very quick points I think that are absolutely critical to the success and everybody's better health and well-being for everybody within the area. And number one is around health education. So it's really important that we understand why, rather than just how do you go about trying to be healthier. And part of that is understanding the reasons and the rationale behind vaccinations themselves. Number two is around cultural confidence. It's really important that somebody you trust helps you, and ultimately that level of confidence is an asset that everybody needs. Until people understand the reason why, from somebody who they can relate with, from somebody who can communicate to them and understand their backgrounds, it's really difficult to be able to get really strong uptake. And the third area really is around listening and learning. We were talking this morning over breakfast with a number of friends about the importance of listening to the needs of the community, and ultimately it's their voices that shape the services so that we as service providers then can support to help them become healthier. So I think those three elements are really important. But as always, I'd like to tell a little story. I can see a young man here with Mr. Suleiman himself. What's your name, young man? A bit louder. Rayan, mashallah, we've got a big Rayan as well. So I want to share a story with somebody. I want to share a story of someone very similar age to yourself, Rayan. A friend of mine who's a teacher in a school locally, Emma, shared this story with me about young Adam, who was 5 years old, finishing school for the day. She'd had a long day as well, and Adam needed some help putting his shoes on. And so Emma, being dutiful and trying to be as helpful as possible, helped him, and it was really tight getting the shoes on. But after she did it, she stood up and he said, "Miss, they're on the wrong feet." And she looked down and she realized, in fact, she'd put the left onto the right and the right onto the left. She couldn't believe it. She quickly took them off, put them back on again. Still a bit of a struggle, but they went on a bit quicker. So the second time around, Adam had his shoes on, but he looked at Miss and said, "Miss, they're not even my shoes." And she couldn't believe it, so she took the shoes off again for the second time now, and she said, "Which shoes are yours?" She said, "Miss, they're my brother's shoes, and Mom told me not to tell anyone I was going to wear them to school today." So she can't believe it, so she had to help him for the third time, helped him stuff his feet into these shoes, stood up, put his coat on, put his hat on, and said, "Now Adam, tell me, where are your gloves?" And he said, "I always put them in my shoes." Now, the reason why I think that's relevant, and when Emma shared it, I thought that's really the story of what community interventions are all about. Making sure we understand what they need, the shoes on the right feet, ideally, but more than that, being able to walk a couple of steps in the shoes of the people we're trying to serve. That's what makes the biggest difference. And many, many thanks to the NHS. I know Barbara and all of the team have been trying their best to get this in a community setting. Vaccinations already exist in schools, in various other places. And over the years, perhaps we've just become used to it. Sadly, vaccinations are a bit like a security alarm. You have a scare and then you decide to get the house alarm at the rear like we did recently because you've had a scare. What we don't want to do is wait until the burglary takes place, or in our case, a health incident, and then respond. So prevention is absolutely critical. And many thanks to all of you for coming today, to making this a success. I think there's a great lesson in this, which is number one, we see you all, we're listening as much as we can, and we're going to try to work with you to make sure these services serve your needs in the best way. So thank you all very much.
I'm Emily Chiesa, and I am a nurse who works for the Hertfordshire Community, and we run the community and school-age immunisation service across the east of England. We are very, very excited to be here today in Berry Park opening our immunisation hub. And we hope to see very many of you here checking your immunisation records and coming in for vaccination. We are a team that is passionate about vaccination. We understand what the benefits are to our communities when we have good vaccination uptake. And that's what we want to achieve here. But we need your help. So please come forward for vaccination and when you're invited. And we will be here to answer your questions, your queries, and allay any concerns that you have around vaccination. But remember, vaccination is safe and very effective against preventing vaccine-preventable disease, which is what we are all trying to achieve here. And we need to improve vaccination rates in Berry Park, because that will ensure that we protect everybody. And the higher the vaccination rates that we can get, then the more protection that we can provide for the community. There are lots of diseases that are preventable through vaccination and through getting good vaccination rates. And that is what we want to achieve here in Berry Park. So please come down and see
The opening times here? The opening times?
So we will be advertising our opening times. They will going to be sent over the next few weeks, but we will be inviting them. So if you've got children that are missing their measles, mumps, rubella vaccines, teenagers missing their teenage vaccines, if you're missing other vaccines, then we will be inviting you to come we will also look to start offering more clinics as well. So all the advertisers through local social media, any way that we can get the message out to you. So we look forward to seeing you, and yeah, let's all work together to make sure that we can improve vaccination rates in Berry Park.
Thank you so much.